Okay, we are streaming live on our YouTube channel, and we will be also streaming it live on our Facebook platform. So, Assalamu alaikum and good evening to all those who have joined us today for our third session, which is a talk to a doc series, which is a part of JK Scientist special series. In this session, we have expert panelists from different fields of medical sciences who discuss with us and give us brief about different illnesses that are prevalent nowadays in the world, and we largely focus on our valley in particular. So, as part of JK Scientists Talk to a Dog series, today we have two special guests with us who will be with us for almost 1 hour, and they will be discussing things around COVID-19, its prevention, and the associated health risks. We have with us today Dr. Masrat Bala, who is a known figure. He doesn't need introduction. We are really grateful and thankful to Dr. Masrat for being with us today. Dr. Masrat A. Bala is joining us live from the United States. He's a medical director at the Healing Hands Primary Care, Illinois, USA. We are also glad to have with us Dr. Usman S. Akhtar. He's a hematology and oncology fellow at Roswell Park Comprehensive Cancer Center, USA. Dr. Usman will be the moderator of the session, and Dr. Masrat will be the panelist or the expert with us today. Thank you, Dr. Masrat and Dr. Usman, for being with us today. And you can go on with the technical questionnaire that you guys have with you. And we will also be having some questions which our viewers will send to us via YouTube or Zoom or Facebook platforms. Dr. Usman, once again, thank you for being with us today. So please, you can continue the session.
Sure. Thank you very much. Bismillahirrahmanirrahim. Assalamu alaikum, everyone. And thank you for joining us. And thank you to the JK Scientist group for doing this for us. Before I actually start, I'd like to kind of set the scope for what the next 1 hour, what we're going to talk about in the next hour or so. So this is really not a technical conversation. We're not going to be talking about the details of the various vaccine platforms or the nuances of the virus. This is really for the general public. What we want to talk about is really the state of the pandemic, how you can protect yourself, what to expect from vaccination, how life changes after vaccination. And of course, Dr. Bala is our expert, and he's been dealing with this pandemic since last year, March, and we hope to gain some insights from him. So without further ado, let me introduce Dr. Bala. So Dr. Bala is a very well-known figure in the Kashmiri community here in America and also around the world. He needs no introduction, as my friend Fan was saying. But just to introduce him professionally, he's the medical director of the Healing Hands Primary Care and Therapeutic Interventions. He's also a medical preceptor at the Midwestern University in Chicago. In addition, he's also very much involved in the Muslim community in Chicago and is the director of networking and a board member with the CMMA, which is the Chicago Muslim Medical Association. Thank you so much, Dr. Bala, for joining us. And I really appreciate you taking time on the weekend to answer some of our questions.
No, thank you so much, Othman. It's nice, and I'm privileged to be here. In any way, if I can help the Kashmiri community at least get an insight into the condition and how we can help ourselves, it's always a pleasure.
Thank you. So Dr. Bala, really, I'm going to start with you telling us a little bit about the trajectory of the pandemic from your experience. You know, Chicago, like New York, was hit pretty early. How are things now as compared to how things were in March of last year when there was utter confusion and chaos here? How have you seen things evolve, just for the general public to know?
You know, as we know, through the world, we were kind of blindsided when this pandemic hit. So most people thought that this was going to be like the SARS-CoV-1, which eventually kind of vanished. And it's an Oriental condition. Eventually it'll go away. So when it first came, I think we all know that the US government and the world in general was not aware of the intensity of this pandemic. They didn't even, they were not even sure if it's a pandemic at all. But eventually when it came and it hit the United States, we were taken totally by surprise. And the hospitals started filling up and people started dying at the rate of, I think we have about 600,000 deaths in the country alone. And within a few months, we had a lot of deaths. But over the course of time, we learned a little few things, and we learned how to save people a little bit by various treatments, but almost all of them were, experimental. But the death rate dropped down a little bit eventually because people we understood various measures to be taken. But eventually, then the vaccination drive came in, and that helped a lot of people. Obviously, that changed the trajectory a little bit. But now again, with the different variants, it is again, getting a little bit hairy right now. But overall, I think the deaths have dropped a lot. Life in general has started to move forward, but the variants are, creating a little bit of a blip or roadblocks to go forward.
Yeah, and that actually comes to my next question. So, right now, one of the most common, everyone is talking about the Delta variant. Even here in the United States, we're starting to see a surge of cases. I actually saw my first COVID-19 consult after a long, long time. So obviously, the Delta variant is starting to create a dent in some of the improvement that we had seen. Just for people in general, what are virus variants? What is the Delta variant, and what are all these waves that everybody keeps talking about?
Well, we're starting with briefly about the virus. The virus is supposed to be, most of you, JK scientists in general, will agree that a virus is in between a biochem object versus a live object. So it's neither dead, neither alive. So that's why it is the simplistic structure of the virus, which makes it extremely difficult for us to figure out. So the viruses, there are literally thousands, maybe hundreds and thousands of viruses that we know of. But most of them we are able to handle because they have a lifespan which is not that long. And if we can kind of wait it out, the virus will go away. But some, linger on, like the flu virus is the most common one, which comes every year in waves, but we're able to handle it. But this virus has the capacity to kill. And it's a fatal kind of virus. So that's why it became, of concern, and especially because it is so contagious and so infectious that it can go from person to person really quick. So the main attributes of this virus are that it can go from object to human, from animal to human, and from human to human, which is really an epidemiologist's a nightmare. That means it can do everything. So in general, viruses adapt over a period of time, and they create what is called as variants. The variants are, it is the virus's way to survive. So we all know that living organisms, their main goal of all living organisms that we understand is progeny, is to propagate. So when the virus feels, I shouldn't say feels because it doesn't have a thought process, but as it moves through the community and it finds roadblocks, it finds ways to change itself in the face of adversity. So how it happens, variants, strains, and everything, these are all interchangeable words. We don't need to know about that. But what we do need to know is that one, Viruses can change because of survival. And number two, it can be by accident. That means when the viruses replicate, they don't always form like exact copies of their own progeny. So some of the copies come out and they are duds. They don't do anything, but some are really vicious. So it's a combination of two things. So to eventually summarize this, uh, all viruses go under adaptation, under mutations, and changes, and some of them can become more vicious than the parent virus.
Yeah, thank you for that really nice explanation. So let's talk a little bit about prevention, because really at the heart of our response to the pandemic has been prevention, either initially before we had the vaccine by social distancing and masks, and later on by vaccines. I'm really going to start with masks, because in the United States, as you know, for some reason, this is a very, very controversial topic. In Kashmir, I don't think there's a lot of controversy, or it doesn't take the same identity politics that it does here. But a lot of people question whether masks are effective. So, conclusively, are masks effective?
Yes, the answer is yes. Well, if you look at the 1918 pandemic, the quote unquote Spanish flu, um, you could say that effectively it was the masks that really stopped the pandemic. And even then, what has changed between then and now is that we still have the masks. Those are the mainstay of how to prevent the transmission. And the vaccine is the only difference between then and now. So masks are extremely effective. I'll give you an example that we normally see millions of cases of flu every year in the United States. But once we put the masks on, we saw almost the most minimal amount of flu. So that should answer your question that it stops viruses. It is, by culture, every country is a little bit different. So even though the Asian countries, they are known to be adapted to the masks because of pollution, whatever way you want to say it, but they are used to it. But in the Western countries, it's very, very foreign idea to put masks on. I mean, the quote unquote, we could say liberty and all of that. And then on top of that, politics came in which people were thrown into two groups. Maskers and non-maskers, for lack of a better word. But so it was politics, but scientifically, absolutely, masks work.
Yeah, thanks a lot. And I just take your statement on the flu. So my wife works in a pediatrics hospital, and she did not see they hardly saw any RSV through the winter, which is extremely unusual. I mean, they were waiting to fill up their beds with all these kids having respiratory infections, and it just didn't happen. It just didn't happen. So another question that a lot of my friends and colleagues are often asked is, okay, mask is fine, but what kind of mask should I wear? Should I be wearing a cloth mask? Should I be double masking? Should I wear an N95, a KN95? So for the general public, like, what kind of masks should they be wearing when they're outdoors or indoors? Tell us a little bit about that.
When the first pandemic started, the best type of mask that is available is the N95, the Neosh 95, which stops 95% of the organisms that we're talking about. But what happened was there was a shortage of N95 masks, and we tried to ration it only to the medical personnel. So almost all masks will do something. The cloth masks and the other types of masks will do some, will give you some protection. But the best mask still is the N95 mask. or for the Asian version of that is KN95. The difference between the two is just the regulatory bodies. So N95 is the American version or the Western version of regulatory body that checks to see whether it works, and the KN is the Asian or the Chinese version of the mask. So to answer your question, we need to understand a little bit about how it is transmitted. So we know for sure that it is transmitted by droplet infection. So droplet meaning bigger water or fluid or saliva, droplets that can carry this virus from one place to another, along with other, things like aerosol, which is the fine mist that carries it. So what happens is that every mask will at least decrease the distance to what this droplet infection can go. So if we have any mask, when we sneeze or cough or we do anything that will transmit these droplets, it will at least drop down within a certain area. And then so any mask will do that. But on the other hand, it is the K95 masks or N95 masks, sorry. They are the ones that can stop the virus actually. And they not only do they have the structure to do that, but they also create what's called electrostatic charge in which it is trapped and won't go further. So any mask will help, but I recommend if there is availability, everybody should be wearing an N95 mask. So I might be held responsible for saying something like this, but the truth is the truth. So if it is available, use the N95 mask.
Yeah, in fact, even at the start of the pandemic, as you know, we didn't even have regular masks available here. So even surgical masks were not available, and they were not even recommending that the general people wear. But then they had to quickly change that recommendation because it was based on logistics rather than on the reality of the biology of the virus itself. So you recommend that in general, people need to mask up. Just to conclude what you said, if they have access to N95 or KN95s, go ahead. But if they don't, then any sort of mask is useful. Correct.
100%. Masks is universally accepted as the way to stop this pandemic, as one of the major things that we can do. Yes.
Right. Of course, I mean, this is a very simple question, hand sanitizers, washing hands. Tell us a little bit about, you touched on how the virus goes from an object to a human. So a lot of general people wonder whether, does washing hands really work if this spreads through the air?
This is a little bit controversial, but I'll tell you what I feel after all the research and after what we have seen. One, washing hands is universal. We should wash hands. What it does, it actually physically washes the virus off your hands and other objects, and it goes away. Second, the virus has what is called as a lipid layer. It has its structure around it has a lipid layer which stabilizes the whole virus. But when we use soap, it actually dissolves the lipid virus and the virus dies. So it is important to understand that soap is very important, along with the alcohols. At least 70% alcohol is needed to inactivate the virus. But let me add something here, is that more and more research shows that is not our focus. Not to take away the fact that, yes, we need to wash our hands, we need sanitization, but the primary mode of transmission of this virus is respiratory, and cleanliness is quote unquote godliness, but that's not the real mode of transmission, is still respiratory or air. Now, second part is your question is it transmitted through air? Yes, it is. So we might want to sugarcoat it. We might want to do anything that we, to kind of not to create panic. But now I think we are about, over a year into this pandemic. So now we can tell you that yes, it does transmit through air. In fact, what we know, at least what we established, is that it stays in the air for 3 or 4 hours at least. And that is enough to say that it is transmitted by air.
All right. So I know recommendations about gatherings are local and based upon local virus trends. So I don't think that it's our place to make local recommendations for people in Kashmir. But in general, tell us a little bit about your approach prior to vaccination and after vaccination. How are you approaching social gatherings? How are you telling your friends, your family, and your patients to approach social gatherings indoor and outdoor?
I of course will tell you what we do here, but more importantly, what people in Kashmir should do. Um, we should, everybody should have a mask on. One. Number two, as far as gatherings are concerned, uh, with my background, which I just told you, that if we are inside and if we are certain number of people are in the room or in this in the area that you are, and if even one person is infected, there is a very high chance that you will get infected. If you stay in the gathering 15, 20, most likely 30 minutes, you will be infected. So masking is extremely important, not only to prevent yourself, but to prevent others from getting this virus. Um, Vaccination has changed a few things. One, the recommendations keep evolving and changing. So we shouldn't hold the scientists responsible for, us changing the recommendations, because we don't know about this virus too much. And as we learn more and more, almost every day, things will change. So at first it was that vaccinated people do not need to mask up, at least in thinly populated areas and things like that. But since the Delta variant and other variants, we recommend that anytime you're inside and in a gathering, even though you are vaccinated, you should mask up. And strangely enough, believe it or not, it is not necessarily for the vaccinated people. It is for the unvaccinated people, that we're trying to protect the unvaccinated people. It's an irony of this is that's what we're doing, because 95% of the admissions for COVID now are from unvaccinated people. So, but we can, if I'm vaccinated, so if but I do carry the virus, or I may carry the virus, which will be enough to infect other people who somehow do not want to be vaccinated. So to answer your question, if you are in a gathering inside, you have to mask up, vaccinated or not. If you are outside, and you don't need to mask up. If you're outside, if you're not in proximity with other people, you're fine in the open air to not mask up.
I think that makes complete sense, actually. So, since you talked about vaccines and the life post-vaccine, especially the fact that 95% of the admissions we're now seeing are people who are not vaccinated. Let's talk a little bit about vaccines. And the first question that I got, and that I keep getting still at this stage of the pandemic from friends, from family, is, should I get the vaccine? So it's a very simple answer. I know what you're going to say, but how do you address such a question when you are asked? It should be so obvious, but how do you address it?
You're right. It should be obvious, but there are questions. I mean, people have a right to ask. Information is everywhere. We know everything. You can Google or you can find everything. And then you get all of these different versions of the same thing. But if you ask the scientific community, vaccines are our only way, repeat, only way to get out of this pandemic. There is no other way. There is no treatment. There is prevention, but to achieve what is called as a controlled immunity, to stop the virus, we have, our only tool is vaccination. Vaccination, to go back a little bit, just for people to understand that we would not be a society like we are if we wouldn't have eliminated smallpox, if we wouldn't have controlled measles, if we wouldn't have controlled other virus diseases, which were effectively eliminated and were removed from the face of the earth just because of vaccination. So vaccination should be right. It should be simple, but there are no vaccine is 100% safe. I mean, there are going to be 1 in a million or 2 in a million that will have some side effects and some really serious things going on. But 2 in a million is 0.000, I don't know what, but so you can't go by that. There is no perfect thing in the world. But will it save us from this pandemic? 100%. Everybody should get vaccinated. Everybody should be, protected with the vaccine. There is just no, I don't have any hesitation in saying, absolutely, go ahead and get the vaccine that is available to you.
Wonderful. So one vaccine over the other, in Kashmir, the two most common vaccines available are the Covishield and the Covaxin as of now. Here, most of us got Pfizer's or Moderna early on, and then a lot of people got the Johnson & Johnson shot. What do you tell people who tell you, should I get one vaccine over the other?
The famous saying is the best vaccine is the one that's in your arm. So any one of these vaccines are well tested out. They are tested out in the millions of people. I mean, sorry, they have now millions of people have it in their bodies. So any vaccine is going to give you protection, at least the ones that are, the official versions of that. So do I have time here to go a little bit about the vaccines or what the vaccines are?
Absolutely, please do. Absolutely.
So the vaccines basically are, we have had vaccines forever, but there are different ways of making vaccines. The most primitive, I shouldn't say primitive, the most oldest way of making a vaccine is the live attenuated virus, in which what we did is that we took a virus, we weakened it, put it in the body, creating an atmosphere of a semi condition or a weakened condition of the condition, and then that prompts the immune system to create antibodies and attack the condition itself. Then over a period of time, several other types of vaccines were developed, and viral vectors, recombinant. There are various others, but the latest one that we're talking about is the mRNA virus. So, sorry, mRNA system or mRNA method of viruses, of these vaccines. So my point is, it's progress. It's not, everything moves forward. I mean, we don't use flip phones anymore, right? Almost every single person in the world has a smartphone. So mRNA the vaccines are supposed to be the best and the most efficient way of stopping this virus, and it is safe, and it can be manufactured in bulk. So yes, all systems of making vaccinations are there, and mRNA is probably safe and is probably the best right now. But to answer your question, Covishield and Covaxin, they are two different vaccines which have been made under different platforms, but both are effective. I know Covishield is more internationally accepted because of the AstraZeneca-Oxford connection, but Covaxin is an indigenous Indian vaccine. I don't have a lot of information on it, but whatever is available, it seems to be that it is effective. At least over 50% effective, which is still good.
Yeah, and that we often forget that the flu shot here is less than 50% effective. So right. So the numbers that we see when we're quoted 70%, 90%, those are pretty exceptional numbers. So I'll just ask you a few quick questions about the vaccine. The first question is, obviously, when people are hesitant to get the vaccine, many a times it's because they don't know what to expect. So what are the adverse effects, if any, that people can reasonably expect from the vaccines? And, I know that here we deal with the Pfizer and Moderna, but even with some of the platforms that they use in Kashmir and in India and Pakistan.
In every medicine, there is no perfect medicine, there is no perfect vaccination. So there will be a very, very small percentage of people who will have some adverse reaction, but the number is so small that I don't even know if I should mention that. Second is that the normal, if you get symptoms like fever, arm pain, some chills, fatigue, tiredness, you know, strangely enough, that it means that the vaccination is working. It actually means that it is inciting or starting a process of saving you and creating an environment in which your body recognizes that when the real thing comes in, that it's going to be ready. So we should actually, people who get these symptoms should say that this is working. So the most common symptoms, to answer your question, are arm pain, fatigue, tiredness, some light fever, body aches, which is one of the most common ones. And I would say take it as a badge of honor. That means you are now being protected against the real thing.
Okay. All right. So and I had a really bad reaction with my second shot. So I think I wear that badge of honor with honor. So yeah, I had to actually leave the hospital. I was very sick, and then I had to be literally pulled out. So my second question is about blood clots. Lot of publicity, a lot of media attention on blood clots, particularly with the J&J and AZ. And I think we wouldn't be doing our job if we didn't at least talk to people about it and then tell them, put things in context. As you said, that there's so few that they're probably not even worth mentioning. So how few are they, and should people be worried about them? And if people need to worry about them, what kind of people need to worry about them?
For the AstraZeneca vaccine, which is most notorious for this, especially coming from Europe, 4 in a million got a clot. So we're talking about such minuscule numbers that it may not even be worth mention if it was not for this publicity that this virus is getting. So the possibility of clots is extremely low. So that should never be a deterrent for anybody to stop it. Besides, let me tell you this, once the flip side of this is, once people get COVID, 12% of people will get clots. And most of them, the clots are pulmonary embolism, which can be fatal. So you can see that if somebody gets the COVID, he is more likely to die of clots than as a remote possibility of getting clots with vaccines. So, and let me tell you this though, and even if we get clots, 4 in a million in the vaccine, we are able to control it right away. We know how to treat that. So there should be no problem, and we should be able to treat the patient right away if they do get into this issue. So no, and also let me also say that for all anaphylaxis, meaning severe reaction to these vaccines or milder reactions, we have the ability. The medical science has the ability to treat you for that. It's not a problem. We can. It will almost never lead to a very, very serious thing because we can treat it.
Yeah, that's really important for people to know because, as you rightly said, there are adverse effects. There are some small risks with any treatment that we give, including acetaminophen or paracetamol, as it is known. But even then, the vaccine is not going to be any different, but we have treatments for it. And I was working with one of the people who was describing the VITT, as it's called, the vaccine-induced thrombocytopenic it's very much like HIT. Yes. So, and he was like, he was amongst the earlier people who was describing it, and the incidence is 3 to 4 per million. And there's absolutely no way to predict who's going to develop a blood clot and who's not. And when they do, we do have treatments for them. So thanks a lot for putting that in perspective for people, that it's 3 to 4 per million. So in Kashmir has a population of around 10 to 12 million. So we're talking about 30 to 40 people versus the degree of protection that we can expect. So talking about protection, the Delta variant, what do we know? And I know the data is still is still in its infancy, but what do we know about vaccines and the Delta variant?
Um, what we know is that the Delta variant had its roots in India. And I think part of it is that we all agree, or all scientists agree, that whenever there is a big congregation of people which are unvaccinated, this is a great breeding ground for the virus to evolve, to adapt. And the Delta variant is basically the same virus, but it has a different spike protein. It has a different, it is slightly different from what the original SARS-CoV-2 or the Alpha, varieties were. So it has a different spike, which possibly makes, not possibly, which does make it more contagious, more infectious, about double the prior one. So that means you have a 100% chance of getting it more than it was in the prior. So they have in an attempt for the virus to preserve itself, the infectiousness or the contagiousness is the important part. So that's what it's trying to do. And in that process, you double the amount of people will get this infection, and it was created, I would say, because of big congregations. Does it cause more severe disease? I don't think there is evidence that it causes severe disease, but it has the capacity to infect a lot more people than the original virus. So that's what it is. It is more infectious. It may not be more severe, but it is more infectious in it, and it is now the predominant strain throughout the world.
And do the vaccines prevent infection from the Delta variant? Are they effective against the Delta variant?
Good question. Yes, they are. All evidence is showing us that we are able to prevent the disease from the Delta virus, but with vaccines. But let me take a second here to understand, what do we mean by vaccine efficacy? What do we mean? What do how the naysayers will always say, "What? I got a vaccine and I'm still sick. What's going on?" So, as we said, do I have time for that, Othman?
That was going to be my next question, actually. How do we define vaccine efficacy? So please talk. Please fire away.
Yeah. So vaccine efficacy means how much the vaccine is effective in a controlled environment, and of course effectiveness means in the real world. So my point that we want to know is that almost no vaccine has claimed that they can absolutely stop the disease in you. They have never claimed it. No vaccine manufacturer or the scientist has claimed that. What we have claimed is that whatever percentage of efficacy or effectiveness is that we can prevent a major illness, a real symptomatic illness with the vaccine. That is 92, let's say for Moderna, it's 92. 92% of the people will only get a mild symptomatic if they do get it. And the 8% we don't know about. They can get the full-blown condition. Then on top of that, but what we know and what is driving us to tell you to get the vaccine is that 100% of almost all vaccines say that they can prevent hospitalization and death. I mean, that is the ultimate. We are trying to prevent death because we don't know who will die from this. We have no idea other than the risk factors, but there are people who have none of these risk factors and are taken away. So all vaccines will prevent you from serious hospitalization and death. That should be enough to understand that how important the vaccines are. We have never claimed that the vaccines can stop the transmission, because it could be laying in your nasal passages, but you won't be affected. And it has we never claimed that it is going to stop, the propagation of this. But this is preservation, self-preservation. So if we can get 70 to 75% people vaccinated, it can actually stop the chain of the virus, and we can stop it, which is called as controlled immunity as opposed to herd immunity. Herd immunity is a concept which is not going to work in, which seems like it's not going to work in this virus. So controlled immunity can only be achieved if 75% of people get vaccinated, and I encourage everybody to get vaccinated.
Some questions about special populations, pregnant women, for example. Can they get the vaccine? Are we giving pregnant women vaccines here?
Yes, we are. We are. In fact, there was a report just a few days back from CDC. It is totally safe and effective in pregnant women. In fact, they even went ahead and said that if pregnant women get COVID, their symptoms are much, much worse, and their possibility of dying is even higher if they are pregnant. So we can give vaccines in pregnant women and lactating women without hesitation.
And immunocompromised people.
Oh, of course. I mean, there is no doubt about it. We all know that immune compromised, anybody who has advanced disease of diabetes is high on the list. People with cancers, chemotherapy, organ transplants, weak or frail individuals, people on medications that cause immune suppression, people on dialysis, people morbidly obese. These are all people immunocompromised. We are, in fact, just maybe a day back, the FDA approved a booster dose for this population. So yes, of course, there should be no question about that group of patients.
Absolutely. And I was actually going to ask you about the booster dose because, obviously in our practice, my practice, most of the people are immunocompromised and they wonder whether the vaccine is effective at all. And we tell them exactly what you said, that, it is effective. We now know that the efficacy in some cancer patients, particularly people who have had a bone marrow transplant, may be slightly less effective, but you can give these people a booster. So what are your thoughts about booster? Do you think that's something that we are eventually going to see for select populations, for everybody, or is it just too early to speculate?
It is too early to speculate. To be honest with you, we are learning. In other words, these pharmaceutical companies, scientists are learning every single day because they check the antibodies and all of that. We don't have any precedents about this virus, so we learn every day. What will eventually happen? How often I have been asked this question many times, is that how often do we need to get this vaccine eventually? I don't think anybody knows, but I think at least this vaccine or most of these vaccines will provide protection for at least a year, and then we'll learn it. In my opinion, in the longer term, I don't think it will be like a flu vaccine. I don't think it's a yearly vaccine, but it will be more like Tdap and things like that, in which you get a booster every 3 years or 5 years. But that's still out there, so I wouldn't like to be quoted on it in a way that it is that's what's going to happen. But most likely that's what's going to happen.
Right. So I will now still talk about the vaccine a little more, and
Sure.
I'm going to talk about vaccine hesitancy.
Yeah.
It's very important for us as healthcare professionals and scientists and so on to have a very nuanced view about vaccine hesitancy. And here in the US, we deal with a lot of people who have vaccine hesitancy for a very wide variety of reasons. What is your advice to people who are themselves not vaccine hesitant, but they have a family member who's vaccine hesitant? How do you, what advice do you have for them to approach their patients, their families, their friends? What things do they need to keep in mind, and how have you approached friends or family who may have been hesitant with the vaccine, to get the vaccine?
It's a complex scenario because it involves social, political, and many other features. It's not it's a loaded kind of question, so or scenario, I should say. So what actually happens is that the anti-vaxxers started here long before in America, or in Europe actually also, is that they started long before the pandemic. People were stopped. In fact, let me tell you that measles made a resurgence because people stopped here, giving measles shots. And that was the reason is, this falsely propagated idea that somehow it causes autism and other conditions, which is absolutely not been proved. Let me tell you that that's all hearsay. It's not real. So it had started a while back, but now, but then after the pandemic, I think it was politicized more than what it actually is. So it became Asia versus America. It became, one political party versus another. And when you have people who are leaders, who will create that environment in which you are with us or you're against us, they defy the scientific community, and there's not much we can do. But I think the best part is education. I think education of the masses that it is safe and nothing's going to happen, and that's your only way to getting out from the pandemic. I think education is most important. Also, eventually, even if we don't want to take the vaccine ourselves, I think we have to look at the fact that what can we do for the community? Am I doing a service to the community by not getting vaccinated? So is there a collective responsibility that I have, that if I don't get the vaccine, I may be fine, but my 80-year-old grandfather is going to die so from it, and I may be fine, but I may make the lives of many people miserable. Do I have that responsibility? Do I believe in that? Do I believe in community responsibility? I think that is important. But and we also, as we said, we give them reassurance that any side effect or anything that you will have, will be able to handle it as a medical community. So that's not an issue. And I think information about prior vaccines is important, and visuals about smallpox. I show them. I show my patients some visual about smallpox, about measles, and how miserable life was when they didn't have vaccines.
So, life in a post-vaccine world, do you think we will be coming back to normal anytime soon? And at what level of vaccination do you think we will be able to start opening up?
All epidemiologists believe that 75%, between 72 and above, is necessary to stop this virus. So yes, eventually when we all get vaccinated, or most get vaccinated, we will be able to stop the virus. But there will be clusters. There will be clusters for many years. I think there will be clusters for at least 5 to 10 years. But those are not going to stop life. We will continue what we're doing. We are able to save people. So the clusters are going to be in the areas where there is immune compromise, or people are under vaccinated. They have to think about the community themselves. But in general, I think as we get more and more vaccinated, life will start back to normal. There will be variants, but we'll be able to handle them pretty effectively.
Yeah, I agree with you. I think one of the challenges has been that there's been so much inequality in how the vaccines were distributed. Countries like the United States and Europe had a surplus, whereas if you look at Africa, the vaccination rates are less than 10% in so many countries. So I agree that this is likely to be there for a long time. One last question about the vaccine and about the virus as such is, what patient resources do you advise for people who want to know more about the vaccine? There's a lot of disinformation, as you were saying. Any recommended websites, any place people you think can get access to information that's easy to understand, and perhaps even easy to translate in Kashmiri for people back home?
I mean, for sure, there is so much of, there is a variety and a plethora of, information out there. But I think we have to go by the government mandated in each country is always the best version, if they want to promote it. So, but in general, worldwide, cdc.gov is probably the most updated, information, because they have all the scientific resources pooled, and it goes through a regulatory body, and you will get the real information. But of course, WHO uh, is available, but I have somewhat lost a little bit of faith periodically on them because they have provided some misinformation in the past. But overall, they are the most funded, and they appeal more to the masses. So WHO, and of course the local authorities. I mean, you know, there, I cannot undermine the fact that local people, local nurses, your local health professionals. One of my, you know, I know many of my counterparts who work, who I worked with in medical school, and after that are now, you know, in the districts, and they are doing phenomenal job of educating people, for just phenomenal job, going there, out there as what quote unquote, you know, COVID warriors, going there without thinking about themselves in Kashmir, and they're going in and trying to vaccinate people. But let me tell you this, though. There is even in the South Asian population here, we don't see much resistance in vaccinations. It is the local indigenous white black population in America that are you know, hesitant. So I don't think we will have big problem of vaccine hesitancy in Kashmir or in India as in general. So I think most people are accepting that they need the vaccine, and that is a big difference from what we fight or what we have here.
All right, and I think pretty much have wrapped up with most of my questions. Lastly, I'd like to ask this platform, the JK Scientists. Someone put up a question that how can we use this platform, at least as healthcare professionals, to increase awareness? Do you have any ideas on what we can do to reach out to the masses?
I think since the best we can do is, because these are the JK Scientists are an extremely dedicated group of people to Kashmir in general. They have the knowledge to educate people. So these platforms or sending more information or education is probably the best thing that we can do, and tell people, you know, keep people updated as to the latest latest changes that are happening, the latest information that is out there, so that people can make an informed decision. I think JK Scientists is already doing a fantastic job. We have other groups like Kashmir, KASHMER, and other groups that are also doing the same thing. You know, to provide resources that would be not that would be related to the disease itself. You know, kind of medical instruments, things like that. We always do that. That is true for any condition in general. You know. Whether it's ventilators, whether it's you know, and other things we can send. Unfortunately, the one thing that we can do right now is send vaccines, even if there was surplus. We can't do that yet, but eventually we may be able to. So education is number one, and the fact that you are out there trying to help Kashmiris in the best way they can, you guys can, it's fantastic.
Thanks a lot. I want to ask Dr. Khalid Gul if there are any questions that propped up on the page. I'm not on Facebook, so I don't know. But
okay. Thank you so much, Dr. Usman and Dr. Masrat. It has been indeed a privilege to hear all the things that you have put up so nicely and kindly and in detail. I mean, as you already told, that there's plethora of information available on the internet, but I think that the way you have presented it to us and everyone who will be watching us after this session on the YouTube, it will be very informative for them as well. Thank you so much. So, Dr. Masrat, we have a few questions. First one, how can we manage post-COVID symptoms like fatigue and muscle wasting?
Known as long haulers, this is a condition that we now we accept and we recognize is the long-term effects of COVID. The good thing is that it will eventually wear off. Almost with all of the viruses, like we had chikungunya and we have a few other viruses, there was a long hauler situation in all of them, and most of them, in fact, recovered totally. It just tells us that it should tell us that how much kind of damage this virus does to the whole body. So it does not spare any system. So we can get fatigue, tiredness, memory loss, headaches, in general, listlessness. This is part of the what's called long haulers or the post-COVID syndrome. We should be able to recognize it, but eventually it will wear off. Most scientists believe 6 to 9 months it should be gone. In fact, this is also a point that it's best not to get COVID because you're not done. You're not done once you're done with the acute problem. There is a possibility, and we see these patients. We absolutely see these patients who come with these symptoms.
So also, Dr. Masrat, we have a question related to the COVID and the vaccination thereof. I mean, if somebody has previously been affected by COVID, and what is, in your opinion, what's a good time after COVID that he should go for vaccination?
Most of the consensus is 1 month, but I would say they can get it tomorrow. I don't think there's a big difference because we have seen it safe because we're not testing people before they get vaccinated, right? We're not testing them. We don't know whether they had COVID or not. So that tells us that it is safe by giving patients a vaccine without knowing the state of COVID in the past. So to answer your question, I think safely we can give in about a month, and it is established fact that the vaccination provides a better immune response than natural immunity. So yes.
So one more question that has been asked is that there is a large chunk of population. I mean, we had a previous session related to heart health. So we had a similar kind of question in that session also. There's a large chunk of population in Kashmir specifically, which suffers from hypertensive disorders or CADs or are on beta blockers. So what is your advice to them that if somebody is having a serious heart ailment or is having a minor heart ailment or CADs or is on beta blockers, should they go for vaccination?
They should actually be more on it than anything else. They need it because they're already in some ways immune suppressed. Their body defense mechanisms are weakened. So they need all the help they can. Yes, absolutely. They should be able to, they should be vaccinated. In fact, one of the things that this virus does is a condition called myocarditis, which is the inflammation of the heart, and that can be fatal. So to prevent that for an already compromised heart, we got to get vaccinated, period.
So one last question is about the third wave of the COVID that we are hearing in the news, and we are being told about. There's a bombardment of news about COVID actually. So we are also hearing that this third wave may infect mostly the kids under 18 years of age or so. What is your view on the third wave? And if that's true that the kids will be affected more, why are we not vaccinating the kids?
Number one, this wave is a coined term. It means nothing. Wave meaning that once there was a little bit of an ebb because we wore masks, it dropped down a little bit. And then once we became, once we took off all the precautions, it came back again. So there is no wave. This is all a coined term. It's always been there. It just had a lull because we did something about it. So if there is no intervention, like if there is no vaccination, if there is no mass masking, there is, you can call it a wave, but it's not a wave. It's always been there, and it's just going to show up its ugly head again. The good thing about all of this, at least so far, we know that the kids are somewhat protected. They have a robust immune system and they can fight this virus. Otherwise, to be honest with you, there would be chaos in the world. If the kids were affected the same way that the adults or the grown-ups would, it would be a big disaster. But luckily, it's lucky for us that the kids are not affected and they are able to fend off this infection almost universally. So that's a good thing. The vaccines, why they're not provided for the kids? Because there are no studies yet. They are doing them in the United States. We are 12 and above. We can give the vaccines, but 2 and above is being tested right now. So we should be able to get data pretty soon and should be approved hopefully soon for that age group. But again, to repeat myself, the good thing is that the kids are still protected. They can fend off the infection, but we will eventually get to the kids as well for vaccinations.
Thank you so much, Dr. Masarat. Dr. Zahida Kamari she has been with us throughout this session. Dr. Zahida Kamari, do you have any concluding remarks, please?
First of all, just thank you for Dr. Bala for your time and Dr. Usman as well. This is a weekend, but still we feel that it's our duty to get back to our community. Dr. Bala, about this vaccine hesitancy, it's there in the public. And I know so many people in my family as well. So it's really hard to tell them to go for vaccination. They have all the theories, all the myths. And I wanted to bust them through this program. And I think I'm successful. And inshallah, we will see you soon. Thank you so much.
Thank you for inviting me. I think JK Scientists and all the groups, I thank you for all. Thank you, Dr. Othman, for such a beautiful session. I appreciate your time, and I thank you. And anytime the scientific community feels that they have a question that needs to be answered on a clinical level, because we deal with these patients, feel free to message me. I'd be more than happy to answer the questions. But thank you for a fantastic session. Everybody gets vaccinated. Everybody gets safe and masked. That's how we are going to stop this disease. There is no other way.
Thank you, Dr. Masarat. Before we wind up this session, Dr. Usman, concluding remarks from you, please.
Yeah, thank you very much for inviting me, guys, to talk to Dr. Bala and to kind of address some of these issues. And I think most of my questions are questions that have been asked to me and that, in my family, as Dr. Zahida was saying. Dr. Bala, thank you so much. I think your message was very clear and candid that we are not out of this yet. Prevention is the way forward. We need to vaccinate no matter what, and still protect ourselves and still mask up, because there is still a chunk of people right now in Kashmir, at least in India, there's around 70% of the population that is still unvaccinated. So unfortunately, even after we are vaccinated, we're not at a point where we can let our guard down yet. So thank you for your clear remarks. I really appreciate your time, and thank you to the JK Scientist Group for inviting the both of us to talk about this and do our little bit.
Othman, thank you for being such a wonderful
so much.
moderator. It was really nice to Dr. as well and Dr. Kamri as well. You guys did a fantastic job. Thanks.
Thank you so much, Dr. Masarat and Dr. Usman, for giving us time. I mean, as Dr. Zahida has already read that it's a weekend and it's very difficult to find time on a weekend when all your days are jam-packed with a lot of work. So on behalf of JK Scientists and on behalf of our outreach team, which is Dr. Zahida Kamri is the lead for this program, Dr. Mir Zahur Gul and Dr. Saima Beg has helped us organizing all the stuff around. I would like to thank them on behalf of JK Scientists. And also I would like to reiterate in this session that since the day COVID started, we at JK Scientists have been on toes, at least vis-a-vis passing the information related to COVID back home. And we are very, very happy, and we would like to thank our own people that, drawing a comparison between the quantum of hesitancy or resistance to vaccines has been relatively very less back home than even it has been in the US. And we would like to thank our people for this. At the end, I would once again thank Dr. Masarat for being with us today and Dr. Usman. Thank you so much.
Thank you.